Hi, Anne Marie. I don't think Nikki's here, is she?
I do not see her.
Okay, we have everyone else and it is 5:30. So we're going to get started with the regular board meeting this evening for the Fargo Board of Education. It is Tuesday, October 12th, and hopefully Nikki will join us soon. Is there a motion for approval of the agenda? Jim?
Yeah, I move adoption of the agenda with the addition of the HR addendum that was sent out earlier today.
Second.
Okay, there's been a motion and a second for approval of the agenda with the HR addendum. Jennifer, question?
Yes, thank you, Rebecca. May I also ask that we take item C from the consent agenda and move it to business for discussion?
Is that something that works for you, Jim and Robin?
Sure.
Okay, so the motion would be to approve the agenda with the addition of the HR addendum and the item requested by Jennifer, item C under consent agenda, GP2E changes memo 44 to be added to business. All in favor signify by saying yes.
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 Opposed, same sign. All right, motion passes. We'll move on to recognition of audience. One person has signed up to speak with us tonight. That is Kristen Charbonneau. Kristen, at this time, the board will hear comments from you, from the public. We ask that each speaker who has signed up to address the board state their name and address for the record. Speakers must refrain from using this forum to criticize or complain about a specific employee or student by name. Vulgar or profane language will not be tolerated. The board is interested in your comments and will listen carefully, but is not obligated to respond or to debate issues in this forum. Should you desire a written response to a specific question, you may request it. This evening, you will be allotted a maximum of 4 minutes. Upon conclusion of the allotted time, a chime will sound and the speaker will be you will be asked to conclude. If it is necessary, a final chime will sound 15 seconds later, signifying the end of your time at our virtual podium. I would now invite you, Kirsten, to speak. I wanted to check with everyone here to make sure that we have muted unless we are speaking. I do hear that there's some background noise, so I want to make sure we are able to hear our that we're able to hear Kristen. So, but go ahead, Kristen, when you're ready.
And the background noise might be coming from me. I'm actually at a volleyball game. Kristen Charbonneau. I am a resident of Fargo, North Dakota, and I am speaking about the mask again, requesting that the mask be removed. We live in a country that was founded on the premise of freedom. The majority of people would agree that eating more fruits and vegetables, exercising more, and decreasing consumption of sugar leads to a healthier lifestyle. But we do not have mandates about it because we value a person's freedom to make choices. I have never heard of anyone, with the exception of children that don't want to eat their broccoli, refute the positives of eating vegetables on our health. Why is it we don't have mandates stating that children are not able to participate in sports unless they eat strawberries, or that you can't be in an advanced reading class unless you eat carrots? These ideas sound ridiculous because they violate a person's freedoms. Having freedom is the foundation of our democracy. I am formally requesting a written response from the board to provide how you have been given the authority to make medical decisions for our children. Thank you for your time.
Thank you, Kristen. Have a great rest of the evening at that game. That concludes the audience member participation portion of the agenda. So we'll move on to the reports, and we have a couple reports here this evening on positive school culture monitoring. The first report is from South High School, the BARR program, BARR program. Dr. Birch, Dr. Mortrud, and Dr. Usselman. Is there someone who would like to kick this off? Go ahead.
I can sure go ahead tonight. Thank you, President Knudsen, for having us and allowing us to present a little bit on the BARR program. that started here at South High School this year. Last year, Dr. Ulselman shared with the admin team at South High a program known as BARR, Building Assets and Reducing Risks. The program has originated in the Minneapolis area and was created by counselors and teachers. What we learned is that BARR will help us organize the communication of data of our current intervention programs, incorporate and embed SEL curriculum into classrooms on a weekly basis, and connect teams of teachers to groups of students who will receive supports at different levels of need, thus increasing student-to-student relations and also student-to-teacher relations. Our focus this year is on our freshman class. Dr. Ulselman and Megan Even submitted a grant request to the state of North Dakota on behalf of Fargo South to assist with funding last spring, and the grant was approved. By being a BARR school, we have also access to a network of many educators in multiple states and school districts who can provide ideas, suggestions, programs, resources to empower all students to succeed and graduate. We are fortunate to become the first BARR school in North Dakota. BARR is the nation's leading evidence-based school improvement model that intentionally deepens relationships and utilizes a data-driven, personalized, and supportive approach. There's a lot to talk about BARR, and I'm pleased that Assistant Principal Dr. Shannon Mortrude and PE teacher and BARR coordinator Molly London are here this evening to provide specifics about BARR purposes, implementation strategies, program specifics, and an overview on BARR programming thus far. And I believe also Dr. Ulselman will be able to share a few words as well. So at this time, I welcome Dr. Mortrude to be able to take us through the PowerPoint presentation.
All right, so thank you, Dr. Birch and board. I'll just quickly go through a little bit about BARR. It's a deep program that we're just learning about, but I'll provide you with an overview. And then if you have questions, Molly London or myself can answer them for you. This is the BARR definition provided by the institution itself, but what I will say is the part where it talks about realigning existing resources is what we needed at South. We have many interventions and many things that we do to create a quicker transition for our 8th to 9th grade, and we have constantly been problem solving for the last 4 years that I've been there, and I'm sure many years before, on how to make that transition quicker and to create those relationships better. So I'll let you sit with the definition, but I can say that we've noticed this alignment of systems and just systematizing our resources as a benefit of BARR. And their slogan is kind of same teachers, same students, better results. There's 8 key strategies. We have a 3-year implementation model where Molly and myself get a lot of coaching from their institution. Right now, our focus is on looking at the I-Time curriculum, which is a social emotional curriculum. We've gone through the professional development, and we are focusing on the whole student and that engagement from all of our teachers. But we will work through all of the 8 strategies as the implementation continues. Why BARR at Fargo South High School? I just was talking to somebody today about, we chose BARR because we were spinning our wheels on how to create some alignment at the high school level. And this was created by a high school and a high school counselor. So we have always been looking to improve our transition from middle to high school. We find that 9th graders really catch their groove 2nd semester, and that's just not good enough for us. We want those relationships and that connection to be quicker. And so we looked for BARR, and luckily Tamara Ulselman introduced it to us, and we thought this would be great. Goal 2, increase credits earned for Fargo South High freshmen. As we all know, on a transition year, if you don't really understand what's going on in high school, that's where the easiest loss of credits can happen. The district has an attendance goal, and so we do too, because we align with our district goals. So to improve attendance, those relationships and connections, that's one of the #1 things, along with parent outreach, to get students' truancy to be reduced. And then a long-term goal is to increase on-time graduation. Research shows that if you fail a core as a freshman, your dropout likelihood increases. So we are in the business of avoiding that. This is a picture of our BARR team. We have many freshman teachers. We went through a training this summer with the BARR Institute for 2 days, and I will say we had buy-in before, but after that training, there was no doubt in our mind that we made the right choice. Again, we are funded under a grant. Dr. Tamara Usselman introduced us to this from Moorhead. Molly London is our BARR coordinator and is a key piece to the success of our implementation so early and successfully. She really manages the day-to-day of BARR data and BARR meetings, and helping the teachers step into their roles. And then these teachers are 9th grade teachers. We also have counseling staff trained in our school SWIFT and administration. This is a graphic from the BARR institution, and I appreciate that it encompasses what all can happen within a week, and I will briefly go over these components and then we will be done. iTime is the social emotional learning piece of the curriculum. Our small block meetings are for our teachers to talk about students in the classroom, positives, any challenges they're running into. Big block will incorporate more of our support staff, so counseling, SWIFT, if we need interventionists, they will come into those meetings. And then risk review is for those students that need the wraparound services outside of school as well. I will say one of my favorite components so far is iTime. Molly London really leaned in quickly to this, and our teachers did as well. And we started week 2 with our students, teaching our SEL iTime lessons in the classroom. They receive one once a week. I will not read them to you, but I've listed all of the lessons that we've gone through thus far. And then on the right, there's a bit of a quote from a teacher who was working through an iTime in her classroom. And one of her students that maybe hasn't really caught on to loving being in class, or I don't know what trickier means, but she was enjoying the time and was sad to see that the period had passed so quickly. So those, bits of data that aren't so formal are the stuff we like to hear, though, because it's creating those relationships from student to student and student to teacher, and that's the point of the iTime. And then, like I said, the small block, big block, and risk review meetings are for students at different levels. So 0 to 1 are 0, they have, they're trucking along just fine, but we want to reach out to them and make sure their families are engaged. Level 1 students might have some teacher level interventions that they can work with, or, being able to spot if a student's mood has switched, because all 8 or, 7 teachers can be informed of this. Big block are for those that might need some, using our ESSER dollars. We have student success advisors, ILC interventions through counseling, our intervention room. So we have a lot of interventions already built in, so we can filter those students. And then risk review is really getting our school social worker and counseling staff involved to get wraparound services, so those barriers don't create big divides for those students, and we can get them engaged. That was a fast and furious overview of BARR. If you have questions, please let us know. And like I said, Molly is here to help answer them as she lives this every day.
Does Dr. Usselman want to say a few words before we get to questions?
Thank you, Dr. Birch. I just want to do a shout out to the Fargo South team, Dr. Birch, Dr. Mortrud, and the entire team down there pulled BARR off, and I think it's implementing well. And I believe it's probably one of the greatest equity things you can do, because it benefits all kids, those who are doing pretty well now and those who have struggled. So shout out a thanks.
All right, thanks, all of you for that information. Board members, any questions or comments? I don't see any hands up, but I'm certain that you will be happy to take questions if they come up down the road. And thank you for providing us with the information ahead of time so we're able to read through it. Wonderful work and great to learn about. Have a great rest of the evening. Thanks for being here.
Thank you. Have a good night.
You too. All right, the next report we have is regarding mental health supports, and it is memo 45, Jennifer Saar. Welcome.
All right, thank you. Yes, just wanted to take this opportunity to share some information with you tonight regarding the continuum of mental health supports. Prior to the pandemic, I think one of the pieces that we were all recognizing is that more of our students were experiencing some mental health needs that we wanted to be able to support them and provide some assistance to them in the classroom. And so we had started engaging with some opportunities in our schools and connecting with some community resources. And then as this pandemic has continued to be prolonged across the nation, and Fargo is no different, and therefore our schools are not any different as well, we're starting to see some additional mental health needs, and in preparation for that for this school year, thinking through the lens of that multi-tiered system of supports and being able to provide supports to students, the right students at the right time at the right level of intensity to meet their needs. We have been working to enhance and introduce some new opportunities for students as well. And so I know you received the report that is pretty comprehensive of all of the supports that the Fargo Public Schools is providing. Tonight, what I wanted to do was just to share with you some of those changes, some of the pieces that have been enhanced and some of them that are new. So starting at that tier 1 level, thinking about school-based prevention and universal interventions, we had the opportunity to hear a little bit about that social and emotional and behavioral instruction and support from the Fargo South team just now. And so that's one of the pieces that we're happy to see happening for our kids as they're transitioning and this pioneer program as they transition from 8th grade into the high school. In addition to that, at our elementary levels, all of our elementary schools have the opportunity and access to Second Step, which has been our longtime social emotional learning program that has primarily been provided through lessons by our school counselors. What the digital curriculum does now is it allows our classroom teachers to also be providing those instructions. And so what we have requested is that all classroom teachers are providing at least 3 of those direct instruction lessons through the digital curriculum. And last year was our first year that this was an opportunity at our middle schools. And so this is year 2 that our middle schools are also using Second Step in their advisory time to provide those direct instructions to students on social, emotional, behavioral needs and skills. We are also currently in the midst of doing some screening, K-12. And so what that looks like at our elementary level is we have teachers who are completing the student risk screening scale on internalizing and externalizing behaviors, which is a universal screener that will administer 2 to 3 times each school year. Last year was our first year administering that at the elementary level. And so it's an opportunity for us to look at some of those more overt behaviors, those externalizing behaviors that we might see in the classroom, as well as monitoring for those covert, the harder to see internalizing behaviors of students, so that we can be sure that we're providing them the right types of interventions and supports. At the middle level and at high school, our counselors are meeting with students one-on-one. They have a variety of different meetings, different names for those meetings, but essentially they're touching base with every one of their students in the fall, and they will again in the spring, on a questionnaire and looking for any supports that they might be requesting or in need of. All right. One of the other items that I wanted to share at this tier 1 level is the Connect and Support program. In partnership with Together Counseling, this is our second year of partnering with them. Last year, the Connect and Support program was under the name of the COVID Support Program for teachers or for staff and for students. And what it provides is an opportunity for anybody in the school district to receive up to 10 30-minute telehealth sessions with a clinical counselor free of charge. And so we are able to pay for those sessions through the North Dakota Behavioral Health Unit, a grant that we had received. And as I mentioned last year, we piloted it in the second semester. And so what you can see on your screen now is that we had 27 of our students take part in 161 clinical sessions. And we had 15 staff members who took part in 32 sessions. So it was a nice response, and we were glad to be able to continue to offer that this year for all of our staff and students. Then looking at that tier 2 level, this is where we start thinking about targeted school intervention. So intervention for some kids as it relates to mental health with community supports. I want to highlight specifically here restorative practices, and through some ESSER funding, we have hired a restorative practices district facilitator, and her name is Kat Field. And what she is helping us to do this year is to continue the training that we have previously been contracting out. And so she is on staff to help train our staff members as we continue to implement restorative practices across the K-12 system. She's also going into classrooms to help teachers, to coach teachers who are implementing Circle and working with them to build community within their classrooms and to support schools and teachers to do so. And then at the tier 2 level, when we start thinking about restorative practices, that's when we start to do some of the training on responsive dialogue. And so being really intentional about how we question or we have conversation with students if they have been demonstrating behaviors that have been challenging. But then also thinking about those who've maybe been harmed by somebody else's actions, whether it's verbally or physically, trying to help them to process through that. And so she has been working with us and will continue to provide that training over the course of the year. This is our year to really move into the middle level, where our middle school leadership teams will be specifically trained on the tier 1 elements at the onset of the school year, and then moving into things like the responsive dialogue towards the end of the school year. Kat also is able to go into our school buildings to provide restorative conferencing, which is a very formalized process for debriefing when some greater harm has been done. Additionally, we have hired a gentleman by the name of Jim Corbett, who is also a restorative conference facilitator, and he is housed at Carlton Eielson. And so both Kat and Jim are working with situations, as I mentioned, where the harm maybe has been greater and has caused a greater impact on the school community or among adults or students in the school. And so what they do in that restorative conferencing component is they start with that responsive dialogue. So on this slide, it's called restorative questioning. So those very specific questions that elicit conversation amongst all parties. That happens first with all of the students involved, or all of the people involved, because it's not always students, on an individual basis during the pre-conference. And so pre-conferencing can be somewhat time intensive because it is the intention of the conference is for everybody's voice to be for everybody to feel that they've been heard. So bringing their voice to the table. In preparation then for the restorative conference, for all of the parties come to the table together and are given the opportunity to share that same information with one another so that they can be heard, but that they can also hear the impact that the situation has had on everybody involved. And then it ultimately ends in an accountability agreement among the parties that can be things that they want to do to make the situation right, or how they want to repair any harm that has been done. So restorative conferencing is fairly new to us. Last year, again, we had started on a contracted basis with some outside partnerships. And this year, we're excited to be able to have that right in-house that enables us to respond more quickly and more thoroughly with our with any situations that may arise. Moving into the tier 3 level, that's when we're talking more about that intensive school intervention with community support. So a little bit more intensive, and typically it's this time of year that I have the opportunity to share about the Student Wellness and Family Facilitator Program. So I want to be sure I do that again. Just a reminder that the SWIFs provide that voluntary referral-based support, specifically around mental and behavioral health needs. And with the idea that they are trying to help families get connected to those community supports that their family might be needing. This year, we are fortunate to have 12 student wellness and family facilitators, 10 of whom are licensed social workers. And 3 of them have been hired last year and this year on some soft funding. So we'll continue to monitor that as the next handful of years goes by. All of our SWIFs have assigned schools, although sometimes they cross over as they're working with families who have students in multiple schools. And generally speaking, we try to keep them around a caseload of 30 to 50 students, depending on the level of need that each student or each case brings forward. 3 of the 12 SWIFs also serve as homeless liaisons across the district. Last year, as we think about active cases, these are students who actively had a SWIF involved. You can kind of see over the course of the school year what that looked like. At our highest point, we had up to 490 students who were active, and then we ended the year around 385 students. So just as a point of reference for the current school year, at the end of September, we had 402 active cases, so about 50 more active cases than we had last year at the same time. New referrals each year are a reality. We always try to think about the SWIFT program that when we feel like a family has stabilized or a student has stabilized, we try to close out the SWIFT involvement and try to empower that family to continue those supports. And so sometimes new referrals can be students who have previously been involved in the program that are needing another additional boost to help provide some stabilization to the student, or they could be brand new. So as you can see on this chart, the needs vary in different schools across the school district. Last year, we had just over 400 new referrals. And at the end of September last year, we had 71, where at the end of September of this year, we've had 93 new referrals. And then finally, for the Student Wellness and Family Facilitator portion, I just wanted to share, the team spent quite a bit of time last year talking about, what is the impact that SWIFs have on students in the Fargo Public Schools for the long term. And we know that there's plenty of research to support that students who stay in school have better life trajectories and better outcomes. And ultimately, that is our goal, is to have our students graduate. And so what you're seeing on the screen now is for students in each of the school years who have ever been involved with the SWIFT program. So not just as a senior were they involved with the SWIFT, but maybe in middle school, they had worked with the SWIFT for a period of time. They're represented in this graph. And what you see at the blue bar then is the number of students out of the total number that's listed at the top of the bar that graduated on time. So that cohort 0 means that they graduated in that 4-year cohort with the same students that they started with in their freshman year. And then the cohort plus 1, 2, and 3, it's important. Graduation is important, even when it happens maybe slightly delayed for whatever reason that might be. So trying to honor that piece as well. So as you take a look, it can be a little bit deceiving because the bar always represents 100%, and the numbers on the bar represent the actual count of students. And so translated into a percentage, in 2019, we had 70% of the students who had been involved with the SWIFT program graduate on time or graduate in that cohort 0 group. In 2020, that was 64%. And then 2021, we saw a dip, and likely as a result of COVID, down to 56%. Also in this tier 3, just wanted to share a little bit of information about the work that has been happening with the on-site clinical services. And I mentioned this at the start of tonight's presentation, that prior to the pandemic, we started recognizing a need to bring some mental health practitioners on site to provide services to students who had barriers and they weren't able to access those services outside of the school for a variety of reasons. And so what you can see here are the total number of referrals we've had since we started in the 2019-20 school year and where we are at currently with the number of referrals. And so these partnerships are continuing to grow with the community services. And so our student wellness and family facilitators and sometimes our counselors are working with community partners to find a time during the day that the student and the community partner can meet at the school to provide that 45 to 1 hour clinical service. And the last item that I just wanted to share is something that is brand new with us. And that really, when we're thinking about mental health supports, really talks about intensive community intervention with school support, so that the community is somewhat taking the lead. And this year, we're very excited about the program, the targeted case management program that we have been able to bring into some of our schools. Targeted case management is Medicaid reimbursable. And the idea is that they're providing services for a very targeted population of students in order to improve that quality of life. So this is a partnership that we have with Nexus Path here in town. And because they are employees of Nexus Path, what it provides to that student and that student's family is not only might they get supports during the school day, but they also are able to have supports in the evenings, on the weekends, during holidays, over the summer breaks when school isn't in session. So each of our targeted case managers who are working in our schools work with approximately 10 to 14 students who have met eligibility requirements. And then again, that depends on the intensity of their needs. So when we think about the target population with whom those targeted case managers work, students who are eligible for TCM services have to have a mental health diagnosis, and they have to be medical assistance eligible, so MA eligible. And they either have to have a social services report on file with the county, or they have to score a minimum of a 25 on the WHODAS, the World Health Organization Disability Assessment Schedule. This year, in partnership with Nexus Path, who received a grant through the United Way, and with ESSER funds, we are able to have 5 targeted case managers in our schools. We have 1 full-time targeted case manager at Carlton Allison. We have a full-time person at Jefferson whose half of her schedule is targeted case management. The other half of her schedule is to serve as the site coordinator for our community full service community schools grant. So at half-time targeted case management at Jefferson. And then we have somebody who's splitting her time between Ed Clapp and Madison, 4th one between Lewis and Clark and Roosevelt, and then that 5th position sharing time between Lincoln and Horace Smith. And so with that, I too would just be open, Madam President, for any questions or comments.
Thank you very much. Anyone have questions or comments?
I have a question. I don't know if you see my hand, Rebecca, sorry.
Okay, yeah, go ahead, Tracy.
Thank you, Jen, for presenting this information, and really just thank you for all the services that the schools have been providing. It has just not gone unnoticed for us who are caring for kids out in the community. It's really been just a relief during this pandemic. I'm never surprised by how many patients are already plugged into services within their schools. I was curious when you were talking about the new referrals for both like the SWIFT program and maybe even the on-site clinical services, who is making those referrals? Is it the teachers? Can families self-refer? Is it an outside provider?
So the actual documentation usually comes from the counselor, the student wellness and family facilitator, the principal, but certainly that it comes to them through all of the ways that you've described, right? Through conversations with the classroom teachers, sometimes with parents, having conversations with those staff professionals as well. But the formal document that gets completed tends to funnel through the counselor, the SWIF, and the principal.
Excellent. Thank you.
Robin, go ahead.
Tracy said it well, but I also want to thank you. I always appreciate your work and your reports, Jen. You are definitely an asset to our school district and our kids. I've always been a fan of yours, so keep up the good work.
Thank you, Robin.
Anyone else? The information on the restorative practices and restorative conferencing has always been interesting to me, and to see how it has been evolving over recent times within the district. So I appreciate that information and the effort that staff members are undertaking to help us move towards that process, which seems to be a healthy one for resolution, at least to some very important conflicts. All right, I don't see any other hands, so thank you very, very much, yes, for the work that you do. Have a great evening and stay healthy.
Thank you.
And I see, I believe Kim Belgard. Yes, hi, Kim. Go ahead, Kim, your report is next.
Hello, just excited that we have started our MOU on the recess commission, and our first meeting went really well. We all got some assignments to bring back to our next meeting. We have the meetings set up and a goal of hopefully finishing by January. And also hoping, I just have to get, I guess, together. I'm thinking it's with Seth on our MOU on salary. Is that correct?
Well, or Kim, you and I probably need to talk about that a little bit too, to get things started. So whether that's when we have our next lunch or sooner, we can touch base on that and then go from there.
Okay, so I know Rebecca and I were hoping that would begin in November, and of course has to be done by May. And then I did get a lot more information. So when Rebecca and I meet for our bargaining information, I've got lots of good information so we can get that ready, and we'll have all these tasks plowing forward. So it looks good. And then I was very pleased to went well and really not too many questions. So we are looking forward to moving ahead and figuring out all of those scheduling.
Great, Kim, do you have
secondaries? Sorry, what?
I was just checking to see if you had anything else, because it seems like there's a little bit of a delay.
Oh, can you hear me?
Yeah, go ahead.
Oh, sorry. I was just saying that secondary teachers are wrapping up their conferences, and elementary will be starting now on Thursday. So busy time of the fall, but it's going well.
All right. Thank you very much, Kim. Have a great night. Dr. Gandhi, your superintendent's report is next.
First off, just want to concur with what Kim said. Thank you to Kim for representing the FEA and joining us in our staff town hall meeting. That's an opportunity for us to connect with staff and answer questions. So we're really grateful for FEA to collaborate with us and participate in the town hall that we had for October, and which we had yesterday. As most of you board members know, and for those that are watching, we are in the process of relocating our district office to our new home, which is going to be on 707th Street South. It's a multi-day moving process by departments. So moving forward, starting Monday, October 18th, we will no longer be utilizing our old district office. So our new location for any needs for all departments will be 700 7th Street South. We are adjacent to Hawthorne Elementary. So I think most individuals know where that's located. But if you have any district needs, please contact us there. Phone numbers have not changed. It's just our physical address location. So that's where we'll be housed moving forward. Per previous conversations at governance as well, I was asked to kind of just provide a week-to-week update at our board meetings on where we are with COVID-19 numbers that we have tracked within our district as well. So similar to the last board meeting, I will share my screen right here. And what you will see is our student positives by school week chart. Just a reminder that the different shades of gray are representative of last year, elementary, middle, and high school. And then this year we have the ones in color. So orange is elementary, pink is middle, and then the blue is high school for this school year. And then just like last time, since our board meetings fall on Tuesdays, the current week will always just be what we have in this moment in time, knowing that it's not comparable to a full week because we expect these numbers potentially to maybe get higher as the week progresses and by the end of Friday or even Sunday. So this is where we are with COVID numbers on a week-to-week basis and in comparison to last year.
Thank you, Dr. Gandhi. Anyone have questions right now? Jennifer.
Sorry, thank you, Rebecca. So since this is the placeholder or that governance decided to put the updates under superintendent, can we have discussion at this point and ask questions here? I'm assuming that is your intent.
Dr. Gandhi, are you okay with taking a couple of questions?
I will answer what I can. I have access to this data, and if we don't have some of the answers, we'll try to follow up with whoever the appropriate personnel is.
Okay, let's take a couple minutes for questions then. Go ahead, Jennifer.
Okay, so my first question is around the discussion we had last time on HVAC education and updates. And I'm curious what the status might be with that.
Jennifer, Dr. Gandhi, I'm jumping in, obviously. Jennifer, are you wondering about like the work that has been done in the district around that issue?
Correct, in terms of communicating it out to parents. Has there been further discussions from administration in order to do so? And what does that plan look like?
Dr. Gandhi, do you have anything on that?
We do have information regarding kind of some of the HVAC upgrades that we've done that have been communicated to parents. Some of that was communicated last year. I believe I've shared some of our communiques with board members, whether it was through opportunities that we had with our media partner last year. I believe our director of maintenance and operation did a segment on one of the local television shows as well, and we put out some information. Additionally, we last week or at the last board meeting, there was some information shared on our facility upgrades, or specifically to our HVAC systems, that were attached to the board memos that are still publicly posted as well. So, and without wanting to maybe duplicate our efforts, I'm not sure kind of what else is needed at this point. But I know that we have been able to share some of that communication out.
I think the information that the board has requested you share out has been shared out. Is there another question, Jennifer?
Yes, please. Thank you. Okay, so in your weekly update, you also mentioned meetings that you've had with North Dakota Department of Health and Fargo CAS. I'm assuming that part of that conversation has to do with positivity rates within the community and our numbers within the district as well. And so I was hoping that part of the superintendent report would include that because from what I'm seeing published out there, the positivity rate has gone from, it was nearly 12% the last time we met, and now it's 9%. the number of pediatric beds being utilized. Maybe that's part of your discussion as well. Within Sanford, it's Children's Hospital, it's still being listed as 0. The Sanford Main Hospital is down from 5 to 0. And so I'm just wondering if this is part of that conversation. And then also, we've gotten a lot of communication or questions around West Fargo numbers compared to Fargo numbers. And so I guess I would hope that you could share some of the dialogue around that. And maybe I'll let you start there. And then Rebecca, if it's okay, I'd have one comment after he's done.
Sure. And I would just suggest that we don't get too much into a comparison of one district over another in terms of numbers and how, how they're tracked. I've seen some things, articles, come up in the media too. And I would just prefer that we stick to the information that our district is working with and the process that we have. So Dr. Gandhi, feel free to go ahead.
Yeah, at the August 10th Board of Education meeting, obviously the recommendation that was approved was to follow the mitigation strategies recommended by Fargo Cass Public Health. And as shared at that meeting, and then since then as well, we work with Fargo Cass Public Health and or the North Dakota Department of Health to really dive deeper into the operational aspect of what does our recommendations mean? How does that impact specific situations that we talk about within our schools? So that's what we meet with them on a bi-weekly basis. To have those conversations with them. For example, I believe the last meeting we had with them, we may have discussed 1 or 2 situations. We didn't have many other questions because most of our systems are kind of running in place. Brenton from the North Dakota Department of Health does kind of share some of the information that's happening community-wide. We have not been given any guidance to change that either. I don't have kind of the hospitalization bed rates and the positivity rate at this time. I can probably pull up the Department of Health dashboard, but if that is going to be a request for a standing report, I would ask that they come and speak to that data. What was shared with us, or at least from administration, what was asked at the governance meeting was a week-to-week count of the data that we're tracking within the schools and maybe in comparison to last year. So open to whatever that wants to be shared. I don't feel comfortable speaking on behalf of West Fargo. I know that I've shared in the past too. Every administration team is going to do what the guidance from their board is. So I don't think it's appropriate to compare ourselves with them either, out of disrespect to them. And I think they would do the same for us. So if we want to have a larger conversation around the interpretation of data, I would ask the epidemiologists or the representatives from Fargo Cass to provide that report. I'm just kind of going off of what the guidance was given to me at governance. And if that needs to change, I'll look to the board or the board's committee or the majority of the board for what that looks like as well.
And then I would look for that information to come through to governance if there needs to be a discussion for any potential changes. Jennifer, I know you had one other comment, but I see Tracy and Brian have their hands up. So Tracy, why don't you go ahead and then Brian?
I think Brian was first. You want to go, Brian?
I would love to. It's my opinion that Dr. Gandhi has answered what we would like him to answer. And I think, Jennifer, if these questions that you have that are deeper in that, why don't you set up an appointment with Dr. Gandhi and visit with him about those things?
Dr. Newman?
Yeah, thank you. Yeah, I was actually going to share some of these comments at my board report readout, but if I may, I think I'll do them now because it seems to remain to this conversation. And it really is to just address many thoughtful emails that we've all been receiving from constituents about this comparison between the districts. And so I just want to do my best here as a scientist to try and explain why this is really not a good idea. And there's many reasons, but 3 main reasons. So one is the way the data is being reported between the 2 districts. So these school districts are just reporting the amount of positive cases out of the total of students within the district. So that's not really a number that we use in science a lot, okay? So what would be a better indicator would be a case positivity rate. A case positivity rate would be the amount of positive tests that you have out of how many people you tested, not the total student body. And so that denominator is really important, and that denominator is really tricky to get. because students are testing not just on site in schools, but they're testing in other places in our community, like the healthcare facilities, clinics, public health agencies, and now potentially even at home. So we just don't have that number, the case positivity rate, and I think that gets misused a lot, but that would be very helpful. And admittedly, it's hard to get. Number two, and probably more important, is the concept of confounders. So in statistics, we control for confounding variables when we do studies. A confounder is anything that might possibly interfere with anything other than the thing being studied that could affect your outcome or your result, right? And so when you compare these two district case like positivity being reported, no one is confounding for all of the other things that could be affected in that. For example, vaccination rate of the students or vaccination rate of the staff would be a good example. Some of the studies that were mentioned at this last meeting by the experts, the Arizona studies, the difference between those is that those were rigorously confounded for in those studies. So for example, I think one of the ones presented was looking at community rates in where schools mask versus where they don't. It was a list of like 15 different confounders that those scientists studied for: age, race, ethnicity. You know, I mean, I have them all listed here. It's community transmission, population density, social vulnerability index, COVID-19 community vulnerability index, percentage of students uninsured, percentage living in poverty. These are all examples of things that could affect your outcome when you're trying to make comparisons. And no one is taking the steps to control for those. So that's very important. And number three is really just the quality of the data being compared. I think it's come to light, you know, that our area school districts aren't necessarily reporting COVID numbers in the same way. So we're only good as like the numbers that are being reported. So I just think between those three things and many more, it's just not a great idea to compare rates between any school districts.
Okay, thank you, Tracy. I want to, of course, we're on the superintendent's report. Your information tied into some questions that were posed during this time. I don't want to get us much farther off from the superintendent's report than we are. Jennifer, do you have a question that you could potentially direct directly to Dr. Gandhi after this meeting?
Actually,
or does it need to be asked at this point?
No, it would need to be, is germane to this conversation, so it would need to be now. And first of all, really, I'd like to move that we change the current district policy from requiring masks to
Jennifer,
mask recommended.
Okay,
and Robert's, I can do this, and you put this in a placeholder of superintendents, and this is where we're having the conversation. So I'd like to make the motion. If you want to discuss it under business, fine, but I'm making the motion now.
Anne Marie.
Jennifer, could you repeat that? I didn't quite get that down.
Sure. I move to change the current district policy from requiring masks to masks recommended.
Jennifer, could you please, as our parliamentarian, walk us through this? Not Jennifer. I'm sorry, I didn't mean to say Jennifer. Anne Marie.
Jennifer has made a motion. There would need to be a second to then move it to discussion. You typically don't do motions in your report section. You usually do that under business, but she has made a motion.
Which is allowed under Robert's Rules of Order. Mm-hmm. Okay, so there's been a motion made. Is there a second?
I'll second it, David.
Okay, there's a motion made and a second. Jim and Robin.
I call the previous question, please.
And
actually, I think I have the floor, don't I?
I think I'm supposed to because I made the motion, but.
Okay, this is new territory for most of us. I thought that I saw Jim's hand up before Robin's. I may not have been correct. Well, that's what I saw. It might not have been correct, but that's what I saw. Jim, could you please go ahead?
Yep. I'm just going to go on the record, Jennifer and David, and say I'm really tired of this game. And, you know, you can keep trying to use all of our time in these board meetings for this issue. And I understand it's a critical issue, but I don't think anything has changed in this board's position in the last 2 weeks. So I would appreciate it if you'd request these items in the future to be on the agenda under business.
Okay.
Any other discussion? Robin?
I move the question.
Anne Marie, go ahead.
You can't do that. We haven't had discussion yet. So
There has been,
Actually, it can be done. I just
And there-
seconded it.
and I would say there has been discussion.
no, there hasn't, not since my motion. So you cannot do that. I get to comment, and honestly, after Robert's, when I made the motion, I'm supposed to be the first one to be able to speak. So if I may finish what I wanted to say,
And
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 No.
I wish I really wish I had a gavel right now, but I do not. Anne Marie, is it correct and that Jennifer needs to have the opportunity to speak first after making the motion? Is that protocol?
Per Robert's Rules of Order, the person who makes the motion is the one who can speak to it first. You have had someone move previous question and it has been seconded. So you, by that process, you should be voting on that as well. But yes, the person who makes the motion does have the ability to speak to it first.
Since we have had the motion and it's been seconded to move previous question, that is what we need to act on.
you have to follow the procedure, and you violated it by not allowing me to speak first. So you have to do that first.
Bullshit.
I believe we could vote on previous question.
No, you can't. You need to let me speak first, because that is the rule that's the rule. So that should have never been allowed for her to speak first. So if I may just finish, I mean, again, this is clearly about a power struggle, when really I'm just trying to have a discussion that's important in our community. It's important to all of our kids. So if the goal is to just shut me up every single meeting or try to shame me or whatever, or make it extremely difficult, like, we're not doing what's best for our kids. We should have this as a standing item, and we've made that request countless times for governance to do that. Governance chose to put it under the superintendent share out. So here we are. I would still like it to be under business if that's how you all prefer it, versus, some of you don't like to add an agenda item, some of you like, so, I mean, wherever you put it, I don't care, but it should be a standing conversation. And I believe that we all did agree actually to that, at least. So if I may, when we're talking about, confounders and some of the examples that Tracy gave, you couldn't have two communities more closely aligned, Tracy. And if you look at the demographics between West Fargo and Fargo, all of those things that you listed were more closely aligned than even Arizona and the others that you shared. And so when we're talking about age, race, ethnicity, size, all of those things. And so you can't say one data set, have someone come present one data set to say, "Ooh, look at this, it works, this is valid information," and then have this one in front of you, but because it doesn't fit your narrative, try to poke holes in it. The reality is the active cases at West Fargo as of October 8th were 58, and Fargo's were 110. We have a mask mandate and they don't. So clearly they are not working as we are hoping that they could be working, which goes back to, again, way back in the beginning, all of those, within the CDC and NIH said this exact same thing, that within the general population, masks are not going to help you reduce the spread of COVID. And we are putting them and requiring them on our children without knowing these long-term effects. It's incredibly irresponsible. And so, yes, I do think it is my job to bring it up as an elected official sitting around this table to talk about it and to make this motion and to demand answers. You don't just get to move this goalpost or not even have a goalpost and then just say, well, we're going to just wait for someone to tell us what to do. Okay, we're being charged with making this decision. Okay, and we have data right in front of us that is saying West Fargo's at 58 and we're at 110. And by the way, West Fargo responded to those accusations that were made in that column that you were talking about. And they specifically pointed out how it was misinformation, false information, and that their reporting has not changed this year as to prior last year. So to accuse without knowing is also inappropriate and inaccurate, and we're making decisions then based on inaccurate information. So once again, I am asking in this motion for us to move to make this mask recommendation, or sorry, to a mask recommendation, taking away the mandate. It is not an unreasonable request. Those who want to wear masks can still wear them.
Thank you, Jennifer. Okay, so I am going to count that as the discussion from Jennifer as she made the motion. Then there was a motion for previous question and it was seconded. Anne Marie, could you please explain to all of us what we are voting on?
I will call the roll on previous question. If previous question passes, then we will move to, or you will move right into voting on the motion of changing the current district policy of requiring masks to mask recommended. So first, we're calling the roll to end discussion at this time. Paulson?
All right.
No.
Benson?
No.
Gullickson?
Yes.
Holden?
Yes.
Johnson?
Yes.
Brian Nelson?
Yes.
Robin Nelson?
Yes.
Newman?
Yes.
President Knudsen?
Yes, motion passes. Go ahead, Anne Marie.
Benson?
I'm sorry, what am I voting on now? The motion?
Your motion.
Correct.
Correct.
Currently,
Okay.
we're voting on the motion to change the current district policy of requiring masks to mask recommended.
Yes.
Gullickson?
No.
Holden?
No.
Johnson?
No.
Brian Nelson?
No.
Robin Nelson?
No.
Newman?
No.
Paulson?
Yes.
President Knudsen?
No, motion fails. Okay, we're done with the excuse me, we're done with the superintendent's report. Oh, we are going to move on to the consent agenda. Is there a motion for approval? We have two items. Jim?
Yeah, I move approval of the consent agenda with the addition of the HR addendum.
Tracy?
Second.
Okay, there's been a motion and approval of the consent agenda with the HR addendum added. All in favor signify by saying yes.
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 Opposed, same sign. Motion passes. There's one item under the business agenda, and that is item C from the consent agenda, GP2E changes, memo 44. Jennifer, you had requested that be moved to business.
Correct. Yes.
Okay.
Thank you. Okay, so the highlighted version, do you all have it in front of you? Let's see. Should have printed it here so I didn't have to pull it up also electronically. But there was some additions under the public comment section, which adds district policy to the wording. And I guess I'm just wondering, obviously this was discussed and it's coming from governance as a recommendation to modify. And so I was hoping that you could shed some light, or someone from the committee could shed some light as to what's the purpose of that. Because as I read it, it feels a little restrictive. There's an awful lot of district policies, and if we are saying to our constituents that they can't address it if they disagree, I'm just trying to understand why the committee felt like it was necessary to do that.
Robin, I see your hand up and I'm willing to add in too, but go ahead. Anyone else on the governance committee? Go ahead, Robin.
Sure. I know, Jennifer, you were part of that call, so you heard the reasoning behind that call. I am unsure why you are bringing this up in the board meeting to question it, since it was clearly explained in the committee meeting, other than grandstanding for the public. Thank you.
Anyone else have any questions on that? Jim, go ahead.
Yeah, well, I believe the reason we came to this decision is we've had people showing up at our board meeting, not following the district's policy, in particular in terms of wearing a mask when you're in district buildings. So that's why this particular sentence was added in. They will be asked to either comply with the policy and put on a mask, or they'll be asked to leave. What we do after that is anybody's guess.
So may I ask a follow-up?
That is the reason that it's added. That's the current example that's been going on in our district right now, which is why the committee felt that that language was needed. Jennifer.
Thank you. So as a follow-up, I am just wondering, how does this then give you more authority to ask them to leave? Because again, if the policy doesn't follow the law, I don't understand how changing this gives you any more authority than you already have. And again, I'm asking you to think about this outside of just one policy, because you can't predict necessarily what's going to happen in the future. So what if there is another policy at some point in time that, you know, somebody would like to address, but it would be deemed as against district policy? So to me, it seems like another way to exclude or intimidate. And it doesn't land. I just don't get it if it doesn't provide you any more authority than you already have.
A point of order, Rebecca, and so there were several, and I'm not just stopping discussion, but there were a couple phrases that were changed. Jennifer, can you be more specific as to which phrase you object to? So I understand what you're asking.
Or maybe, I'm not sure if you object to it or if you're just asking for clarification, but go ahead.
Yeah, I'm just, again, I guess I'm trying to not only ask for a clarification, but really I'm asking you to think about what I'm asking. That you might have made it in terms of this one, in terms of masking, right? But how will this apply to other district policies? I mean, there are many, and could this possibly restrict people in the future? I don't get it. It doesn't give the board any more authority than they already have, because if someone shows up without a mask, you're already saying to them, you're not following district policy, please leave or don't leave. I mean, you already have the ability to ask that, but you can't physically remove them because it's not against the law not to wear a mask. And this doesn't give you the ability to physically remove them either. So again, I'm trying to understand what in terms of thinking about this, it doesn't seem like there's a need.
I believe, and I know, Jim, you had your hand up. I'd just like to say, I believe that part of the reason, at least from my standpoint, for adding the language is to provide further clarification and to provide greater emphasis that it is indeed important to pay attention to and to follow the district's policies. Go ahead, Jim.
Yeah, I was just going to say, first of all, I don't know what policy we have in place that somebody would be violating that would be a problem for us, Jennifer. If somebody brings a gun into the school board meeting, they're violating a policy. They're actually violating the law as well. So I don't think we have any policies that restrict people from coming in and telling us that they want to change a policy. It's not about that. People that want to come and talk to us about removing the mask mandate or changing what we charge for lunch, they can come in and challenge and speak to any policy we have, but we're asking them to follow the protocol of the district in terms of the policies in place for students, staff, and visitors, including us board members. So as Rebecca said, yeah, it doesn't give us any more authority. We already have the right authority. We just are not really sure we want to go to trespass a citizen that wants to talk to us. Hopefully this change will let those people know we're more than willing to hear them, but please put a mask on before you come in to the boardroom to share with us. So it was really about being more transparent, which is what I think is done with this policy change.
Seth, go ahead.
I would also ask the question. We have it in our policy right now that says that speakers will not be allowed to verbally attack individual board members, employees, or students or use vulgar or profane language. And if that's the case, further on it says the president, or set by the president, may be removed from the meeting. It's not illegal to use vulgar or profane language. So what's the disconnect? Are you opposed to that? Are you opposed to us not having vulgar or profane language as a thing? Because it's legal for me to use profane language. So where's the, I'm not seeing the connection between the illegality of something and the fact that it's our policy. We have policies right there stated perfectly in black and white that aren't illegal. So what's the difference with this?
Anyone else have any questions regarding or comments before we vote? Anne Marie, go ahead and call the roll.
There's no motion on the floor.
Oh, I am sorry. That's right. Okay, Jennifer, you had brought this in front for business. Is there someone that would like to make a motion? Jim, go ahead.
Yeah, I'll move that we adopt the change to the GP policy as indicated in memo number 44.
Is there a second?
I will second that.
All right, Seth, seconded. Okay. Boy, we kind of got into this before we had a motion, didn't we? Sorry about that, folks. Anyone else have any other comments to make? All right, Anne Marie, go ahead and call the roll.
Ellickson,
Could you reiterate the motion again so I do this correctly, please?
yep, the motion on the floor is to adopt the changes to GP2E as noted in memo number 44.
Yes. Thank
Holden,
you.
So, yes.
Johnson,
Yes.
Brian Nelson,
Yes.
Robin Nelson,
Yes.
Newman,
Yes.
Paulson,
Yes.
Benson,
No.
President Knutson.
Yes, motion passes. Board reports, committee liaison, and correspondence reports. Dr. Newman.
Thank you. On October 1st, I had my Kennedy liaison visit, which was a lot of fun. I took a tour of the school, saw kind of an idea of their numbers for the year and what's happening in the building, got a list of school events, like some of their upcoming PTA meetings and their fall festival, which I'll be excited to try and attend. I have my liaison visit scheduled with Discovery Middle School this coming Monday, so I look forward to that. And then on October 8th, I had the pleasure of attending the Davies Theater Department Cabaret Night. They did The Villains of Broadway, and it was highly entertaining. And it was a fundraiser for their theater director, Miss Sari, which was very, very cool of the students. Thanks.
Let's see, Nikki.
Thank you, President Knutson. The Communications Advocacy and Engagement Committee is meeting again this week and again moving forward with our current scope of work. And I'm also very happy, as you heard Kim talk about with the FEA earlier this evening, the recess commission has begun. We've had our first meeting and we've actually planned out our next 2 meetings. I thought that it went incredibly well. Everybody's engaged. This again is a memorandum of understanding that came out of the negotiations this year. And so I'm really looking forward to the work, and I think others are as well. I think it's going to be a great team. That's it.
Thank you. Jim.
Not a lot to report. Planning committee is going to meet this Friday at 7:30. That'll be a Zoom meeting for those of you on the planning committee or anybody that wants to tag in with us. The SEC was going to have a board meeting last week, but had to get canceled due to some conflict with one of our employees, and that'll be rescheduled for November. And that's it for me.
Jennifer,
Nothing further.
Seth,
On the 5th, we had the probably shortest and least painful negotiation session by reopening and cleaning up that language that we'd all discussed previously. And then on yesterday, I had an opportunity to take part in the town hall meeting. That was great. And then this morning, I had a good visit with Eric up at Longfellow, and hopefully we'll get to my other 2 assignments this week. So that's it. Thanks.
Robin,
Thank you. Governmental Affairs Committee met week and a half ago, and we had a nice discussion. We reaffirmed our means, so we will not be recommending any changes to the board. We are required to meet at least quarterly. So right now we have scheduled a January 4th meeting, but can certainly meet sooner. Alexis Baxley from North Dakota School Boards Association will be our guest to explain some of the current interim activities. There was a suggestion to include, and Nikki, this might be for you, with our social, with the city and parks, a topic to discuss might be extraterritorial zoning. And then also discuss was we are watching closely as House Bill 1356 rolls out, and that is the major funding formula bill approved in the last session. There are some, we will also be seeking some clarity and possibly with Senator Shively, the Senate Education Chair, about ESSER funds and how we handle temporary positions, because we want to make sure we do right by our educators. A special ed will continue to be underfunded, so we need to continue to watch that. And also we will be looking at some virtual platforms and how to maintain those legislatively. I believe that is all for our GAC meeting. I was also reminded to remind about our per pupil payment. There was another deduct from our per pupil payment on top of our mill levy deduct, which is deducted from our per pupil funding formula. Jim, I guess you're following me on this, but there will be $60 to $80 per pupil reduced from the next payment due to upgrading the STARS, the reporting program, which will cost the state about $10 million. So that will be another deduct coming out of our payments from the state. That really was a negotiation piece to ensure that our state school districts would get a 1-and-1 increase over the next 2 years. So that was negotiated through the legislative process, but Jim, please keep an eye on that, and hopefully you can guide the Governmental Affairs Committee on how to move through that in upcoming sessions. And I believe that is all. Thank you.
Brian.
Yeah, last Friday I was able to do some visits. I started with the Fargo Adult Learning Center with Jennifer Free, and she's doing a lot of cool things there with the adult learning. I didn't realize how many countries are involved with the different people and things. Tomorrow, there's going to be a workforce Wednesday where they're going to, NDSCS is coming out, and the Sanford is also coming out for these people to get jobs, potential jobs while they're going to school. Then I had the opportunity to go to Fargo North and get this wonderful sweatshirt at the student shop. It's always fun to go in there and visit with the students as they're working, and it's an awesome sweatshirt. I'm telling you what, it is heavy. It's probably one of the best sweatshirts I've ever owned. I visited with Travis Christensen. They're going to have the home they're building It's going to be the first Homes for Humanity home to ever go there. And the other thing that I thought that was cool in our visit was how he said the kids are telling him that, and the rest of the staff, how normal the school year feels for them. I was also able to see a picture of the future track that we're going to be building in the future. And then last, I want to get a shout out to some of the Davies all teachers, specifically the ones our son has classes with. My wife and I visited with our teachers, and I was so impressed with the conversation that our son had with those teachers. Very, very professional. I walked out of there feeling great, and I made sure Mr. Cody knew, Mr. Gross, Dr. Gross knew, and Dr. Gandhi and Kim. Shout out to the teachers to keep up the good work. It was really, really professional.
Thank you, Brian. David. I believe you need to unmute.
Can you hear me?
Now, yes.
Okay, I maybe caught 10 minutes of this meeting. My internet apparently is unstable, and I'm getting really, really tired. I hope that we can very soon meet in person. This Zoom is not working, but I heard none of the comments that were made at the end of the meeting. I heard I heard nothing about BARR. I heard very, very little of Ms. Saar's presentation, and it's impossible to follow a meeting if you're at the mercy of the internet. I have no meetings to report on, but I would like to pause us and remember our board responsibilities. And one of our board responsibilities is to respect each other. During the last two meetings, I have been sarcastically offered condolences by one member. I have been told by the same board member tonight, essentially to shut up, because I am trying to speak for the members who are contacting me by email. That is not the way we are supposed to act as board members. I am here not representing myself. I'm here representing the people who elected me. And when they reach out to me via email, I feel it is my obligation to convey some of those opinions to the board. And I resent very deeply the sarcastic comments that have been directed toward me and other board members, when all I am trying to do is do my duty as an elected official and represent the members of this district.
Thank you, David. Yesterday, I spent most of the day celebrating Indigenous Peoples Day. I attended a few Zoom sessions that were at NDSU and on a variety of topics. One of the topics had to do with human trafficking. And last evening, I went to the powwow that was at Moorhead High School, had some awesome fry bread, and got myself onto the floor and danced in the circle. And it feels really good. And it is a very healthy process. I can't remember the date that I went to the Davies Band concert, but it was within the last week or two. It was very fun to be there, and I could tell that the students and the instructors, everyone was happy to be in the theater performing live. And I love live music. I love any kind of live music, and it was an awesome evening. Was at the negotiations committee meeting, the very brief one that Seth talked about earlier this evening. Kim Belgard and I met for lunch just prior to the recess, not just prior, but a few days prior to the recess commission meeting to tie up some loose ends. And then I contacted Nikki, turned it over to Nikki, shared with her information that Kim and I had discussed. And so thank you, Nikki, for representing the board on that commission and for working to keep us informed as the process moves forward. I will be serving on the credentials committee for the School Boards Association convention, and I believe that is it for my report. Thank you all for being here this evening. Our next meeting is October 26th at 5:30 p.m. and it is 6:54 p.m. We are adjourned. Have a great night, everyone.